Yes.
But before, while we're waiting for a couple more minutes, this is the third day of the Creative Care Conference. We just had our second round of panelists and workshops. This space was performing pain, yesterday was arts-based therapy. And yesterday we had a faculty panel of work from around Texas A&M, including Brian Kim's work on autism and gaming, Zena Trost's work on bereavement and opioid addiction and VR spaces, and a lot of other really amazing work that's happening both within PBFA, Performance Visualization and Fine Arts, and also in the broader university. Today, we wanted to sort of parallel that faculty panel with alumni coming from the Performance Studies Masters, but also from English, and you were from dance, right?
Mm-hmm.
Yeah, specifically.
Cool.
And then we have Devontae Love Online, who's also coming from the Perf MA, and Yasmin Gaines, who's also from the Perf MA, I want to say.
I think so, but that was before my time, so I'm not sure.
Before both of our times.
Yeah.
I've been here for 3 years, you've been there for a little bit longer than me. But what we're going to ask them to talk about, and Dr. Spalling is going to moderate our panel today, is on how their current careers and the careers that they've had up into these careers are often very circuitous, winding paths, especially people working in the context of this intersection of arts and health, which is the theme and focus of the conference. So all of them are coming from many different majors, in different backgrounds, in different disciplines, and occupying different skill sets, but they're still coming together at this intersection of art for the social good in one way or another. And I think with that, we'll get us started. So howdy!
Howdy.
All that stuff I just said comes before the howdy. And now I will pass it off to Dr. Anthony Smalling to lead our faculty panel.
Thank you. Yes, as Campbell said, I'm Andrew Spalling. I'm now an associate professor in the Performance and Visual Studies program, and I'm the director of the graduate program in Performance Studies. And yes, as Campbell said, I think maybe we'll start with introductions and see if the food is here, and then continue on with presentations. So perhaps if we just want to briefly go around and introduce yourself, maybe what you studied at the university, and maybe how you kind of started to make your path towards your career that you now find yourselves in. So I'm looking at you. So do you mind starting?
I can start.
Thank you.
Howdy, my name is Alexandra Granato Garcia, and I come to you all today from the ancestral homelands of the Yanawana, the lands of the spirit waters, which are originally San Antonio, Texas. And so land acknowledgement and reciprocity is a big focus in my work today. We're here on the ancestral homelands of the Tonkawa and the Sana. In case you didn't know, you now know. And the beautiful thing about knowing our lands and our environments is that it helps to promote connection and safety within the body, within the self, and within the relationships that we all have within the world. And our relationship begins first with ourselves, then with our environment, and then with those around us. And that is the beautiful work that I get to do in the world today. I'm a registered somatic movement educator and therapist. I'm also a certified somatic arts practitioner. And as mentioned before, my path to this, where I'm at now in creating my business, it's called Flutura Creative. Flutura is actually the Albanian word for butterfly. And that is an archetype that has been ever present in my life from a young child. I grew up on the border of Texas and Mexico. Monarch migration was really huge there. My grandmother always called me Little Butterfly because I was always off meeting people, doing things, wondering about the world. And so I really wanted to infuse that into whatever brand I created in the world. So I use two archetypes in my work, the butterfly and a disco ball. And my studies here at A&M really helped to shape what I've gone to create with this business. I majored in communication with a focus on interpersonal and intercultural communication. And at the time, dance was only available as a minor. And now they have an MFA and they're growing a PhD program, which is just like incredible to see. And I was privileged during that time. One of my professors, she's no longer here, but at the time she was studying somatic movement therapy. And so I had an opportunity to do directed studies. And it was me and one other student, and I was able to begin my journey to certification here at A&M. So I went through, I think, about 2.5 levels of certification before I graduated. And then the world swept me off into the corporate song and dance that we kind of get directed towards. And I did that for 15 years. I worked in food distribution, in training and development, and then I developed into a creative lead when the digital age really hit in 2015. And the company is family owned and operated, billion-dollar company, but had to move to the digital age because that's where the rest of the world operated. So through my creative skills, I began to lead a team of different modes of creativity to create all kinds of materials for the company. It was a really cool job. And then when COVID hit in 2020, guess what happened? I got laid off. And during that time, I saw a lot of the world hurting. And I felt it deep in my bones. And I said, you know, I think I'm meant to do more here and create something. And so that's been my journey for 5 years, is really trailblazing a path and blending my multidimensional, passionate self into the business I have today. And it has been a journey, but one I do not regret, and one I stay deeply committed to the vision in my heart and what I'm here to do. So thank you for having me today.
Yes, awesome. Thank you so much.
That's really beautiful. Thank you for sharing.
Thank you.
I think it gives me a lot of respect for you as somebody. I'm very new into the career world, and so somebody who's trying to find that balance between the creative and pursuing passion versus just the practicality element of it, and
Yes.
having to bring in that business and that corporate world sometimes for just practicality. And so that is so inspiring, I think, to me to hear that you're able to do that and have been on that journey to discover that for yourself.
Thank you.
But my name is Lauren Head. I am class of 2024 from Texas A&M, and I studied English here. I had the fantastic opportunity to work under Dr. Jason Harris for a graphic novel course, my second year here, and absolutely fell in love with the world of comics. I had grown up reading a ton, but especially reading a ton of comics, and not really knowing all of the potential and possibility behind comics until I got in that class and was able to study the theory and the history of the comics world. And so I actually ended up writing my undergraduate dissertation over the intersectionality between Christianity and queerness within comics, and was able to write a full-length graphic novel for that as part of that course as well, for a creative thesis. And really just spent the year getting to delve into many topics that I really love, and just examining the immense just potential of comics to provide an increased empathy effect for readers as compared to, a novel or even something that we can watch and not be forced to participate in. And so I had the opportunity after I graduated from A&M to move to the UK and study contemporary literature and earn my master's in contemporary literature at Durham University. I graduated this past January, so I am, thank you. I'm very fresh out of the school world and into the corporate world. Right now I'm working 2 jobs. One of them is with Right Now Media Ministries, which is a Christian streaming service. It's kind of like a Netflix for Bible study content. It's really been a fantastic environment to work in up in Dallas. At the same time, I'm working as a tour manager for a publisher based out of Seattle called Blue Ear Books that focuses on memoir and historical nonfiction. And so I've been able to dip my toe in the water of publishing, which is where I would like to be.
Beautiful.
With getting to work with authors and authors especially that share their personal stories and really have a heart for when they're touring, not just the marketing side of it, but getting to engage with people that really can relate to their stories or really can learn a lot from it from an emotional standpoint and from a healing standpoint, which is very cool too. And so that's where I'm at right now. There's going to be lots of, hopefully, different careers and different opportunities that come in the future when it comes to working with graphic novels. But I'm hoping to continue to do that in my free time as well. Something I did forget to add is that part of my coursework at Durham was studies of neurodiversity in humanities. And so after coming from A&M with a background in comics, I just felt a really strong pull to incorporate comics into what I was studying with neurodivergent representation, especially with, as I was sharing earlier, and as I will as I will continue to explain a little bit more in my presentation later, this increased empathy effect that comes through comics, the ability to place yourselves into the worldview of another within the comics realm, felt that it was a fantastic space for neurodivergent representation. So I've been able to continue writing some comics in my spare time that I don't have a lot of, but I hope to continue working with that too. So it's projected future, hopefully.
Beautiful.
Awesome, thank you.
Good timing. We'll let the food come in.
Do we need to pause while they put the food out?
Yeah, why don't we,
Maybe let's pause while we get the food out, and then we can continue while we're
Sounds good.
eating. All right, everyone. We'll come back now to the panel. Feel free to keep eating, though. And I believe we have one more person who will introduce themselves, and then we have a couple participants online.
Awesome. My name is Andrew Robler. I am class of 2011, although I graduated in 2013 with a degree in theater arts, BA in theater arts. I did not come to A&M initially planning to get a degree in theater. I started as an international studies major with a minor in Arabic and did that for most of my undergraduate career. I added a minor in theater after my freshman year, and then due to some bureaucratic nonsense, I came back from my study abroad, and the international studies people told me, oh, you didn't fill out the right paperwork before you left, so you have to do your study abroad again in order to graduate. And I said, hey, theater, can I switch into your program? And so that's what I did. While I was here, I will say that I absolutely loved the time that I spent here in the theater program. At the time, it was a, I mean, I know it's still not super large, but it was a small program, a handful of faculty, very personal connections, but it was also a BA program, which I really appreciated because it gave, there was a breadth of exposure and experience that we were expected to have, not only in terms of our core classes, but in terms of, everyone had to take a design class, everyone had to take an acting class, everyone had to, we got to experience the different kind of roles in the theater process, which I think is really valuable. In 2013, I had moved to Houston briefly in 2012, tried to kind of break into the theater scene there and was really struggling. So in 2013, I moved back to College Station because my parents were here at the time and decided to start a theater company. And so I started and ran a theater company called This Is Water Theater here in College Station for about 5 years. Raina Dexter, who's the interim program head for theater here, was one of my faculty when I was here, and now it's a dear friend and colleague. She did a lot of costume design work for me, or with me in those years. But it was also during that time that I rediscovered something that I had found and kind of gotten interested in during my undergrad time. One day when I realized that I was going to be changing my major to theater, I got on Google and I remember Googling the phrase day jobs that use acting skills. I found a blog post from a woman in the San Francisco Bay Area. I cannot for the life of me remember the name of the blog at this point, writing about her experience pretending to be sick for medical students to practice learning how to care for patients. And I remember being really fascinated by that. I'd grown up in the Boy Scouts and had done a lot of first aid training. And what I now realize was designing simulations for scouts to learn how to deliver first aid. And so while I was running that theater company, I realized that A&M was hiring for what are called standardized patients, which are these actors that are trained to portray patients for medical students. And so I got involved with them. It's a part-time gig, very kind of ad hoc as needed. So it's not a full-time job, but it was something that I immediately fell in love with and was good enough at that very quickly the people that were running the program came to me and said, hey, we really, like what you're doing is really great. Can you help teach other people to do that? And so that was my first foray into standardized patient education and clinical simulation. I also became very quickly attached to several clinical faculty who were working on designing some cases, some scenarios, and because of my theatrical background and my educational background, I was able to help them design that scenario from the actor perspective and from being able to kind of translate the clinical language into language that a lay person who's portraying these patients would be able to use. And so from there, A&M Health Science Center ended up hiring me, creating a role for me to oversee the entire standardized patient training program across all 5 campuses of the A&M Health Science Center. And then in 2019, I was presented with the opportunity to apply for a position at the University of Houston. They were getting ready to open a brand new School of Medicine, College of Medicine down there, and they needed someone to design their simulation program and center from the ground up. And so I applied for that and got hired. And so from 2019 to 2022, I was the founding director of clinical simulation for the University of Houston College of Medicine. I do not recommend starting a medical school during a pandemic, but it was a fun challenge. And then in 2022, I left University of Houston to move to the University of Texas Medical Branch in Galveston, where I was the inaugural director of experiential learning and assessment. So moving kind of out of the hands-on side of things into more of the administrative, sitting in lots of meetings, listening to lots of issues and trying to solve problems. I left that job in February due to the state of the state and the state government. And so since then, I still do a lot of consulting work in that field. But I also run another theater company in Houston called the Octarine Accord that focuses entirely on speculative fiction, so fantasy, sci-fi, things like that. We actually have an immersive Western sci-fi show running this weekend and next weekend at the Match in Houston, if you're interested. I also this year kind of pivoted to leadership coaching and taking a lot of the things that I learned over a decade of working in higher education on the staff side and medical education and having a lot of direct reports and people that I was responsible for overseeing and kind of taking again my theater background and the work that I've learned and developing a new model for training leadership called story-driven leadership that I run through my coaching business, Reckless Kindness now. Yeah. That's me. That's what I do.
Awesome. Thank you so much. I'm going to come up here because I don't know if our folks online can hear. Hi, Devante.
Okay, do you want to put me on this one?
Yes, please. So to those of you online, we're doing a quick introduction of ourselves, our background, and how sort of your journey from your education to where you are now, thinking about arts and health. Devante, you're on the screen, so would you mind going first?
Sure. Hi, everybody. Hello. I appreciate the invite. Thank you, Dr. Campbell. I saw Dr. Katari somewhere. Hello, Dr. Mueller. Hello. So, good to see some familiar faces. Hi. For those who don't know me, my name is Devante Love. I'm currently calling you all from the unceded lands of the Canarsie people and the Munsee Lenape folks, also known as Brooklyn, New York City. Interesting question to try to sort of create a story of life up till now. But what I'll say is prior to being at A&M, I had done a lot of work in the realm of martial arts. I had been an international competitor for about 15 years at that point. And I had done a lot of clinical psychology work. That was my previous master's degree. And so I came into A&M wanting to do something to think about how martial arts has this therapeutic dimension. Like, how are people using this practice to expand beyond themselves and also discover themselves and re-relate to each other in the world. So from my inherent practice, I felt there was a deep connection that was happening. And I was so fortunate to be able to go to A&M, and I got to do my master's. And I think I was the first to do a performance and portfolio within the program. So yay! And I was fortunate to be able to work with Dr. Dox. Dr. Spalding was on my committee as well. And I got a lot of really good support in thinking about martial arts and thinking about archetypal psychology and spirituality and how these things come together to kind of illuminate this realm of healing and performance. I found oftentimes in performance studies, people talk about all these different realms, but healing and performance is something that doesn't get talked about a lot. So I wanted to try to create work that speaks into that gap, that void that I was seeing. So I used that time at A&M to develop a style of martial arts that really focuses on the healing and the spiritual dimension. And then I did a performance of that for my final project. That was a really lovely experience that launched me into realizing that I can be both a scholar and an artist. Mm-hmm. And how can my artistry help me become a more serious, rigorous, and deep scholar? And how can my scholarly pursuits help me try out new things with my artistry? Mm-hmm. So I got to see how these things can come together so beautifully, which led me to, after I finished the master's, this is 2023, I moved to Boston, where I live now, and I'm working on my PhD at Tufts University. And there I'm doing a dissertation that's looking from the realms of dance studies, queer of color critique, and healing and performance to understand how voguing specifically becomes a means of liberation for queer folks of color. Mm. So that's the work that I'm doing now. On the side, in addition to that, I'm also performing a lot. I've been dancing a lot in New York and in Boston. I'm working on the second act of my play that I performed at A&M at the moment. And that's going to be toured around to different places. So it's a little bit about me. I'm happy to share more of my journey later. And again, thank you all for having me. And I'm so glad to see familiar faces. Yeah.
Thank you so much, Devante. Jasmine, could you introduce yourself?
Yeah, hey y'all.
Hi.
I am Jasmine Games. I use she, her pronouns, and I am based in Austin, Texas, which is also Coatecan land. I am from Houston, Texas. I was born in Dallas. I am class of 2019 at Texas A&M, but I graduated in 2018. I double majored in English and performance studies. And then after that, I took a year I moved to Austin and taught kids, K through second graders, how to read through an AmeriCorps program. And then I went to UT Austin to get my MFA in Drama and Theater for Youth and Communities. And after that, I jumped a few jobs from being a teacher to working at a civil rights nonprofit as a director of education. And now I have been at a theater company called The Vortex for 2+ years as the director of education and social justice. So yes, I'm also the artistic director of the Poet House, which is a grassroots nonprofit that I co-founded alongside Michael Hatcher, where our mission is to amplify and support spoken word poets, especially those from marginalized groups. We run 2 programs under the Poet House. We run Every Word Poetry, which is a adult programming. We have our flagship open mic that we do every Monday night. It's a free open mic. It brings out community. We do it at the Vortex. We capture and post poets, and then also just allow connection for poets to meet other poets and be in community with each other. And then we have our youth programming called Courageous Cadence, where we use spoken word poetry as a tool for social change and collaborate with high school youth to use spoken word poetry to be civil servants, to go out in their communities and to imagine justice and share their art with a public audience and in community. While I was in undergrad, there used to be a open mic in College Station called Mic Check Poetry. It was really, really popular. I know it's not, it was in Bryan, Texas, but I know it's not running anymore. But that was a nonprofit that I was a part of, and it allowed me to have a community meet nationally awarded spoken word poets across the nation. I was a super fan of spoken word poetry. I was one of those people who would watch Button Poetry and Right About Now Poetry. I would just spend all my hours watching those videos of other poets, and I also competed myself, but I never, although I qualified to go to nationals, I was really school first, so I never traveled. It's one of my regrets. And while I was in performance studies, I was able to study the historical context of spoken word poetry in the African American community, and then also how it derives from orators of the African diaspora. And then when I got to grad school, I got to extend upon that process and really focus on Courageous Cadence is where I founded it in grad school as a graduate project, and focus on how spoken word poetry helps identity politics and helps criticality for youth, looking at our larger society. And so, yeah, I owe a lot to the performance studies program at Texas A&M in terms of allowing me to be able to study spoken word poetry. It is a genre of literature and also theater performance that is not like really prestigiously recognized. There's not a major for it. There's not a place where you can go study it. There's not a lot of academic research on spoken word poetry. So it is something where you have to go out in the community and meet people who have been in this work for decades in order to learn about it. So that is what I've been doing. I've been pouring into my performance, into my artistry more. I am a nationally ranked poet via the Blackberry Peach Poetry Slam. I'm 10th ranked. I'm going for #1 next year. We are, through Every Word Poetry, we are studying the choreo poem, which is a Black feminist practice of performance art. And we are inviting other spoken word poets in our community to participate in the choreo poem, to write poetry for the stage to write about their lived experiences. And we are putting on our first theatrical production of The Blasphemy of a Good Bath, which is Michael Hatcher, my co-founder and also another nationally ranked poet, his work in progress choreo poem. And we have invited other emerging spoken word poets to write new work and stage their work on top of his set. And also musicians, and it's gonna be a wonderful night. And we're really just exploring more of how does spoken word, what are the other ways we can present spoken word poetry outside of the open mic format or the slam format. So I'm really excited to talk to y'all.
Thank you so much, and thank you to all of our panelists for sharing parts of your journey with us. So now I think we'll move into the presentation portion of this, and we'll go in the order that was on the slide, which I believe, if I'm remembering correctly, yes, Andrew was the first person. So
Great.
Andrew, if you don't mind, you
Yeah,
can
this is
begin.
going to be
Thank
pretty
you.
short because I already told you a lot of it. And if you were in the earlier session, it's going to be a little bit of a repeat. So today, the workshop that I led was about fight choreography, but a lot of the work that I do in clinical simulation and education is around dealing with things like fight, flight, feigning, and fear. So situations of stress, right, fight or flight responses, things like that, as well as the portrayal of pain or feigning pain, and then fear or states of heightened emotion, right? So anytime that you're feeling poorly, right, one or more of these three things is happening. You are in a sense of stress, there's physical pain and or emotional, heightened emotional distress. And I do have a TEDx talk on YouTube called I'm Proud of Lying to Your Doctor. If you want to learn more about kind of what the simulation world is like. We'll go to the next slide. So I mentioned this briefly. This is a photo from when I was a standardized patient at A&M. This is in a simulation dealing with a postpartum hemorrhage of a woman who just gave birth. So I was playing the husband. And there's a medical student there along with some nursing students that are dealing with the fact that she needs a blood transfusion and she's unconscious, so the husband is the one that they have to talk to about it. So let's go to the next slide. So I describe clinical simulation a lot of times as immersive theater, but for medical students. Because all of the same theatrical principles are in place. So this is a training, it's still from a training video. I know Danae's head is hidden at the moment, but one of my fellow trainers, Danae, being the patient, and then me demonstrating for, in this case, other standardized patients, what the students might do during the session, during their time with them. So in this instance, we're testing shoulder strength in a particular way with a particular test. So go ahead and go to the next slide. So like I mentioned, immersive theater, but for medical students. It's because we use a lot of the same theatrical tools. In fact, the field of clinical simulation and simulation education, it was started and run for, I mean, the first professional organization for it started in 2001. So that gives you an idea of how recently, in the scope of the medical field, right, how recently this mode of education and assessment came about. The first standardized patients really came about in the late 1960s and 1969. A guy in California named Howard Barrows is credited with the idea to hire an actor friend of his to portray a patient with multiple sclerosis. And he trained him how to portray the symptoms of that. And his goal was that the students wouldn't be able to tell that it wasn't someone without actual MS. And that gave, what he realized during that encounter was that it gave the students an opportunity to interact with and experience what it was like to interact with a patient with MS without putting an actual patient with MS in the situation of having to be poked and prodded and learned on by these students. But in the same vein, he realized that it meant that because he could train this actor to portray these symptoms, he could, one, very tightly control the environment and the situation under which the students were learning, which is not as doable in a true clinical environment because you can't guarantee who's going to walk through the door at any given day. But he also realized that he could train that person to then give feedback about what it was like to be that student's patient. And that's something that's a lot harder when you have the power imbalance of an actual patient with an actual doctor, and you're asking that patient to give feedback on that physician or on that clinician, in the same vein that we have issues in the performance field with intimacy direction, right? Because of the power imbalance between a director and an actor, it's kind of the same thing. And so by bringing someone in to portray the patient, we level that playing field a bit more because they are essentially in the educator role very naturally. And so it becomes a more even keeled conversation. But we use scripts. We also use improv skills, scenic and prop design. So how do we create an environment that feels like an actual hospital or clinical room when there are other things like, for instance, we need to simulate a chest tube that is in a motor vehicle accident victim's chest. How do we do that in a way that is realistic, considering that we can't actually put the chest tube or the suction in the person? And so we use special effects makeup. In this field, we call it moulage, but it's just special effects makeup. But it's special effects makeup that is designed to mimic realistic injury. So whether that's contusions, bruises, abrasions, scrapes, or lacerations, cuts, also things like increased redness of the skin, pallor, which is like the whiteness or the paleness that comes with lack of blood flow, things like that. But even down to how do we simulate an arrhythmic heartbeat when someone goes to listen to a standardized patient's chest with a stethoscope. And so there's a lot of creative ways that people in this field, which I started to say this earlier, but I should clarify, this field is relatively new and it is full of theater people. It is full of theater people. Almost nobody that is in the field now got into the field intentionally. Everyone fell into it, either because they were clinicians and educators that wanted to use this methodology, or there were clinicians and educators that wanted to use this methodology but didn't know how, and so they reached out to a theater person, a theater professor, a theater practitioner in their area and invited them to help start their program. And so there's kind of an even split in a lot of ways. My mentor in the field got her MFA in playwriting before she got her PhD in medical communication, and now runs one of the largest simulation centers in the country up in Minnesota. And so we also use principles and tools behind direction and stage management. During a live scenario, we need to know when certain things need to happen, when certain actors need to enter or leave the room. How do we manage the people that need to happen? A lot of times we're doing these simulations either with a number of large participants at once. So this is another example of a postpartum simulation. Or we have the same simulation occurring in 15 rooms all at once, so that all 15 students are experiencing the same scenario. And then we have to rotate 200 students through that experience over the course of a week or 2 weeks, those kinds of things. And then we'll go to the next slide. So in addition to the things that we use, we also use a lot of the skills that we learn in the arts and when it comes to observation. Because a lot of standardized patients are not only asked to portray the patient, they're also asked to provide feedback after the encounter for the learner. And so this might be things related to communication skills, so the ability to communicate clearly, interpersonal skills, not only interpersonal skills between the patient and the provider, but also the teamwork within the provider team. Clinical skills, so basic, for instance, one of the things we try to teach students is to let a patient know before you touch them from behind, right? So, hey, I'm standing behind you. You don't want to just put your hand on someone's back. You want to let them know what's going to happen beforehand, right? So not only the execution of those clinical skills, but how did it feel to be on the receiving end of those examination techniques? And then stress management and emotion management. So creating intentionally high stress scenarios that feel as realistic as possible so that students learn what their stress responses are and what their emotional responses are and how to handle them before it happens for real. So one of the simulations that I talk about in the TEDx talk that they don't do anymore, so I feel like I can talk about it, was an infant death simulation. So it was designed for nursing students to experience the death of an infant and the grief that goes along with that for the family. And so I played the father of a 3-month-old child who had been admitted to the ER based on a phone call from their caretaker, from essentially their nanny or their nurse, saying that they had drowned in the bath. And the situation was complicated because upon admission, there were signs that the infant was actually shaken and the drowning was used to cover that up. So there's a lot of emotion that goes along with that, right? And so the simulation starts, like the students are briefed on all of this, but the simulation starts at the 24-hour mark because when you're dealing with an infant in that scenario, the patient or the provider can't declare death of an infant until 24 hours of brain death have passed, because infants sometimes are more resilient, and so sometimes they can come back from the brink, as it were. And so the simulation was at that 24-hour mark. So essentially, all that had to happen in the scenario was that one of the student nurses had to, acting as a clinician or physician in that instance, declare the child dead, and then deal with the aftermath of a grieving father. We had another actor there that also played chaplain. And so that gave the students an opportunity to experience what that was like, what it was like to attempt to provide comfort and care only to be brushed off, what it was like to have a grieving parent screaming in their face about why they couldn't save them, why didn't this happen, why did this happen? And so, a lot of times in those scenarios, students would find out their own responses to those situations, and they weren't always the most effective, right? Some people learned that they laughed in those situations, which is sometimes a natural response. But if you did that in an actual scenario with an actual parent who's grieving, right, like you're going to cause a lot more harm than you would if you learn that in a scenario where I'm pretending, right, where I am trying to make it as real as possible, but ultimately I have psychological safety, and because I'm part of the education team, I have that power balance. So those are a lot of the things that we would look at. This photo is from a simulation that we did that was part of a study to look at students' bias recognition, their own self-bias recognition when it came to drug-seeking behaviors from patients. So how would a student respond when a patient that looks like this comes in asking for pain medication versus someone who comes in a suit and tie? And how does that impact the way that they would talk to and interact with them? So that's some examples of what we do and how we do it.
All right, fantastic. I think we'll save questions till the end.
Great.
Yeah. Okay, who's up next? It's Kayla.
So we can. Kayla is doing exactly this presentation for a full class of students.
Oh, okay.
So,
all right,
so
so let's
she's
go
in
to the next
this video.
presentation.
Hi, I
Jeff.
missed this, but I did not prepare a presentation.
Well, that's all good. I didn't. It was kind of up to the participant if they wanted to or not. Like this is going to be a broad discussion of your career path. I was mostly looking to make introductions, so we can do the presentations we have and then have a broader conversation.
Okay, how about we do the presentations for people who brought presentations, and then we'll open it up for a broader conversation. Who else? Did anybody else bring a presentation?
Mine was just more experiential if people wanted to just kind of experience what I do, since that's how my work works. So I didn't have like actual slides. If we want to do that, we can.
Yeah, that sounds great. Yeah.
And
Okay.
Laura, did you have a presentation?
I do, yeah.
Yeah, so we can do hers first and then mine. Perfect. Be an easier transition.
Yeah. Let me get
Or
my
should we
mic
do
back on.
Devontae next?
Oh, yeah,
Oh,
Devontae,
yeah,
you want to
yeah,
go?
for it.
Sure. Yes, I can go.
All right, thanks, Devontae.
Yeah, of course, of course. Let me reframe. This is too big now. Awesome. Cool. So I just wanted to have some slides with some images and some sort of ways to land into my work, so you can kind of get a glimpse of that. So I really consider myself to be a scholar artist, and that's like a major part of my healing practice, of my performance practice, and just how I operate in the world. You can go next slide. Thank you. So the scholar side, as I said earlier, my dissertation is looking at Vogue, its fabulosity. And one thing that I want to emphasize is I'm looking at the rehearsal spaces. Often because I find in a lot of performance studies literature, the focus is on the final performance and then reflecting on the final performance. But so much happens in the rehearsal space. There's so much room for growth. There's so much change. There's so much transformation. There's healing. There's pain. There's risk, and all of that. So I really want to spend my time looking at these rehearsal spaces. And through this, I'm utilizing performance ethnography, and I'm utilizing training that I'm getting through in intimacy coordination to really understand what's happening in this space, what kind of affects are moving through, and in terms of how is this movement facilitating the healing or growth or change in folks. One thing I want to emphasize to folks, if you are thinking about going to get a PhD, which it's a lovely journey, I call it a spiritual journey, is to make sure that you have advisors that are really supportive of the work you do and help expand our own thinking. So I listen to my advisors because I'm very grateful to them for the way that they help pull my work into so many different directions. It's because of them that I've been able to publish work. I have 2 articles that have been published and 2 that are in the works right now. And I love the fact that I'm able to share the scholarship. And all of my scholarship is centered around martial arts and dance as a means of healing or social justice or liberation. Because I find, again, you'll notice I look at gaps in society and in scholarship and in literature. And there's a lot of gap in the connection between mind, body, and spirit. And so that's another way that I'm sort of adding new threads of thinking and moving into academia. We can go to the next slide. Going back to the previous slide, sorry. This was a conference that I did at A&M, actually. This was the very first time A&M did the Students for, like a student success conference that happened when I was there. And I got to present on martial arts. I got to lead people through this sort of martial arts experience. And everyone reported feeling so grounded, feeling like well held and cared for in the conference. So I like to bring these like martial arts movements into these spaces so people have a chance to tune back into their bodies and sort of recognize and land where they are. Next slide, thank you. And the artist side of myself, I'm in the midst of sort of finalizing my dojo right now, the Inner Peace Dojo, which is a traveling queer martial arts healing space. It's part of my mission as a monk. So I'm a monk and I've been a monk now for 5 years, and I have a couple more years until I become a priestess. And part of my mission is to spread inner peace to people through movement and storytelling. For those who were there for my performance that I did at A&M, you'll remember that, or I'll just say for those who weren't there, my work is very much around like theater and ritual and the immersiveness of that. So how do we bring an audience into a story so that they feel they have an opportunity, an invitation to sort of like work through some of their own internal turmoil and grow from that. And so that's a lot of the work that I'm doing through the Inner Peace Dojo, be it through performances that I'm doing or classes that I'm offering. It's all for the purpose of a person's growth and liberation. Yeah, my Instagram is there. Feel free to look at it or not. Just putting that out there. I think that's it that I wanted to say for that. So happy to answer questions if there are any later. Thank you.
Thank you, Devontae. Okay, then we'll
Okay.
do Lauren.
I'm going to speed run this a little bit because I think I want to make sure everyone else has some time too. Okay, so I wanted to talk a little bit more about neurodivergence and neurodiverse representation in comics. You can go to the next slide. Okay, so comics, just a brief history. In the US, they have always existed on the margins. There is, of course, the popularization of comics that we know, which is our superhero comics that kind of began to be popularized in the 50s, but very soon after and alongside was the emergence of the underground comics movement. And that featured a lot of voices that were seeking to represent, take the expression that they saw in comics that were in the mainstream and use them to tell their own stories. And so we've seen a lot of that in comics history since the rise of comics in the US. The reason that this was the case, a lot of marginalized peoples were seeking to tell their stories through comics, were because, as Hilary Shute says in her book Why Comics, it's one of the quintessential texts of comics history. Definitely would recommend reading it if you're into comics. But she says they were created with complete artistic and intellectual freedom to represent an artist's personal vision and worldview. And so this emergence of comics, like women's comics here, which was an all-female created comic, El Perfecto, depicting queer experiences, was something that Shute said that demonstrated that comics had the ability to tackle head-on what most would consider the realm of the absolutely interior and private. And so you can hit the next slide. And we're looking at what makes comics so effective in being able to tell stories that are so deeply personal in a way that other mediums might not be able to. It comes down to expressive freedom through comics and through nonlinear storytelling that comes with the comic form. And then psychological identification as well through the technique of masking, which I'll walk you through. You can hit the next slide. So first, the power of artistic flexibility. So comics are, more often than not, nonlinear narratives, right? They require a reader to step into the story to be able to choose how they want to read the story. So when it comes to, if we look on the left, this comic, we have to choose how we want to read. Do we read left to right? Do we follow the text? Do we decide to follow the pictures, how we are maybe intrinsically wired to do so? Do we decide to look at the text first and then look at the pictures as an afterthought, or vice versa? It really allows for a lot more flexibility in the way that we want to express as creators our stories. There's also, when it comes to depicting neurodivergent stories particularly, there's an opportunity to utilize synesthetics, which are difference in line weight, in texture, in color, to convey an emotion, to convey a tone, and to be expressive in that way. And so when we're able to be experimental with that approach to the creation of the art, then we're able to even mimic sensory experiences that neurodivergent people might experience through their worldview. And so this on the right is actually a comic that I created that's called Bunny. That's just one of the pages out of it that is telling of my own ADHD experience in both academia and then moving into the workplace as well, and trying to tackle some of the glorification, but also some of the villainization of neurodivergent identities that take place in media, especially today. You can hit the next slide. So for creators, this visual storytelling and the ability to be expressive through synesthetics allows creators to externalize and process their experiences. So it can be a means of catharsis for a creator to be able to depict a story in a way that feels very genuine and authentic to themselves and to their feelings, rather than having to follow a specific structure, as you might find in a novel or even in research writing, things like that. But for readers, it also allows them to connect with this authenticity of an expressive worldview. You can hit the next slide as well. But what about comics allows them to move beyond this register with people that have shared experiences outside of that realm, and to being able to be identifiable to neurotypical people or people that might have just differing neurodivergent experiences as well. So you can hit the next slide, and we'll see. So there's a technique that Scott McCloud, who's also a big voice in comics theory and history, describes that's called masking. Masking is a very big term in the neurodivergent community. This is a different type of masking, although the two can be placed together. You can work on them. If masking in this way is done incorrectly, it can result in neurodivergent masking. But basically what Scott McCloud describes masking to be is the idea that comics can take simplistic characters, like we see this face that's made of 2 dots and a line, and it can be sort of a blank slate for readers to place themselves onto. And that way they're able to enter perhaps a background or more centrally stimulating world than they might be able to. We don't expect readers to be able to identify with the backgrounds of our texts or of our creations as much as we do with the characters. And so by fostering that kind of blank center for a character to project, or for a reader to project themselves onto, they're able to enter a stimulating world that can be that can allow them to identify with that and see the worldview through the eyes of that character. You can go to the next slide. Okay, so just overview, steps to effective masking. The simplified characters invite identification for a readership. Readers can subconsciously then inhabit that perspective. And then once they step in, they can see themselves first as that character and then be able to see the worldview through the eyes of that character. So that causes experiential empathy, where people are not just understanding or observing somebody else's story, but they're really immersed inside of that. And we're going to do a little thought experiment, because I think this comic, which is called Button Pushers by Tyler Page, is a really great example of masking. We see Tyler, our main character. He's a fairly simplistic guy. He's got 2 dots for eyes. He's got 1 line for a mouth. And so the theory is that we can fairly easily project ourselves onto this character and then begin to experience his environment as he experiences it. So I'll give you guys a few minutes to look through it. Tyler is an ADHD author, Tyler Page is, and so his comic is about himself growing up with that experience as well in the classroom. Right. So what we can see here is that, as I described, Tyler is a more simplistic character. So in theory, we can place ourselves onto him, but then we see the background melting away. We see the text melting away. We see everything fading behind him. Here on our bottom 4 panels, we can see the close-ups of different aspects of the classroom, different ways that his brain is being drawn away from the main character, or from the main subject that he should be focusing on, which is the teacher. So in that experience, we're able to, it takes us away from, if we were in this situation, we might have been able to pay attention to the teacher. And here, we're brought away, and we're forced to see the world through his eyes. We can't see what we're supposed to be looking at. And so I think that's a really great example of just getting into the mind of how we can begin to identify with that worldview of another. You can move to the next slide. There are some limitations of masking. So this is I think a fairly under-researched theory as far as I've seen so far. And again, freshly out of school, so my experience and my ability to work with that and to continue researching and working with people that use these theories is just beginning. So I'm hopefully going to be able to continue to learn more. But But as of now, there are still some limitations of masking. There is a worry that creating this invisible center, this character that we all can see ourselves in, could flatten a character's neurodivergent experience and place them into trope environments rather than into genuine expression. And so that is especially a worry when you were talking about neurotypical authors trying to convey neurodivergent experiences through the use of comics and using this theory, that they may not be able to express their experience in as genuine of a way and instead resort to using tropes surrounding that. There's also a question of who gets to be the singular character that everyone identifies with. So, that brings in a lot of aspects of Tyler. We see he's a white kid, he's blonde. Is that appropriate that we can all place ourselves onto this character in this environment? But that's also something that people are just continuing to look into and expand the world of what we can do with masking as well. So this is, I kind of went over this, but we can skip this slide. And so finally, comics as creative care. So the possibilities of comics allow for these underrepresented experiences to be made visible. And so for creators, they can be used as a tool for self-expression, for understanding the self as they are able to depict their experiences in a tangible way, but also relation to other people that have similar life experiences. And then again, for readers that can't associate with that particular experience, how they can step into that world. It can be a safe space to inhabit somebody else's world vision. And then here are some comics that I really enjoy if you want a reading list, that I think do a really great job of neurodivergent representation. Some of them are anthologies, and they're created by several comic artists and authors that have come together to create a larger project that is focused particularly on a neurodivergent experience. Some of them incorporate that as a side story as well. So, but I do think all these do a great job of that. That's all.
Thank you.
Beautiful. Thank you for that. I'm seeing so many threads between all of our work, which is just such a beautiful thing. So for my just little experiment for you all, I lead through experimentation. My life is experimentation, and this modality that I've kind of created in blending all of my different worlds, I call the art of somatic living. And it's a series of micro practices that people can begin to learn through the experience of it and then begin to apply it to daily life. Because if we notice it or not, we all have daily routines, which are rituals or traditions or practices. However we want to name it, it exists. Here at this institution, it is one with many traditions, and it's a culture of its own, right? And so I realized that that's probably the thing that really drew me here, was my love for culture and my love for tradition. And A&M has that, and I was able to learn that through my communication studies and through my dance studies. And that's just been something that's like a personal value of mine within my own family system. And then also noticing like how I began to see what I'm drawn to. So I invite you to just begin to think about, as you were a child and now growing up, like what were the things you were really drawn to? It could be like a plant, it could be a place, it could be an animal, it could be a color, it could be an art form, it could be really anything. And then how do we look at that thing through the lens of it being an archetype that we can then see within ourselves? And when we do this, it becomes easier on our body and our system. Somatics is all around creating safety in the body for our lived experiences. And so sometimes it's easier for us to look outwardly before we then take it inwardly. But everything that we experience is a mirror of our internal landscape. When things excite us, when things frustrate us, they're all parts of self. And I use a disco ball as the other archetype in my branding. And I use that because, one, we are energy and we are made of light, and our bodies are made of primarily water. And the way in which we create the shifts and changes in our lives as we grow, as we transform, as we do new things is at a microcellular level through the nervous system, through the water that runs within our body. Water is also what makes up our DNA, our epigenetics, right? And so somatics is about the lived experience, and that begins before we even take our first breath. It begins in utero, through our DNA. It begins through the lived experience that our mothers who carried us. And it also carries through that DNA a lot of epigenetics, right? And so when we take our first breath, then begins our physical lived experience. And that is shaped by a lot of things. And so I use the disco ball to show all the little facets of all the things. It could be like the most smallest comment someone made to you as a child you never even thought twice about, but your body responded in a certain way, and it starts kind of calculating, it starts taking notes. And this is kind of where we get into the embodiment piece that goes hand in hand with somatics, is really understanding our unconscious and our conscious. And how do we understand how our lived experience is being shaped by the two working together? It's the body-mind. They work together. But sometimes our bodies have three brains. We have our logical linear brain, we have our heart brain, and we have our gut brain. And just through our own lived experiences, we tend to default into one over the others. And the goal is to kind of create this coherence. Is how do I make my decisions? How do I experience my life? Kind of running the scenario through head, heart, and gut. And so I use, as the basis to the art of somatic living, I use soma, psyche, and soul. Soma, body, psyche, mind, and the soul, the heart space. And so that's kind of how I begin to bring this bridge. And through somatics is the awareness, embodiment is the presence. How can we allow ourselves to be present with the spectrum that life gives us? Because life is gonna life. And the goal is to not always be in the positive or always be in the negative, but how do we increase our capacity within our flow zone to be able to know when we're pulled one way or the other? How do we bring ourselves back to neutrality, right? How do we self-resource within our body without having to seek outwardly for the things that we need? And nature is a beautiful example of this. And so I use nature as the muse to bring people into pathways into their body. And I love nature for many reasons, but one of the best reasons is because it's free and it doesn't cost anything. And all you have to do is step outside and begin to start consciously creating a relationship with nature, because nature is the basis of all of the environments we find ourselves in throughout our lifetime. And so I facilitate about 90% of what I do outdoors. I'll either work with groups or clients in their outdoor spaces, or I'll pop up in local city parks where I live. I'm fortunate to have really beautiful spaces to work with. And my dream, I'm gonna tell y'all my dream so I can put it out into the ether, is to own acreage and beautiful oak trees, and to build this tree house studio that's like this indoor outdoor space filled with natural light, and it be like the sanctuary where people get to come and just experience the wholeness of who they are through the wholeness of what nature is that carries all of us. And thank you. Yeah, and the coolest thing is about seeding, like visioning is a huge part of what I help people do, is like, no idea is too crazy. And it really starts with like getting curious about the things that light you up, the things that you've been attracted to. Like I've always loved butterflies. Okay, what can a butterfly teach me? You know, and so our mind has what's called a reticular activating system. So when we see something, so I'll tell y'all for my trip here, it has been ants, which most people would be probably disturbed about. But I was like, okay, I got to my hotel, there was a few ants on my bathroom counter. I'm like, I'm not gonna get rid of those ants. There's a message here. And I was like, and there were 5 ants, and 5 is my favorite number. So I was like, okay. And then I had ants the next day in a different place. I went to go visit the century tree and give gratitude to her. And there were ants on the bench under the century tree. So I was like, okay, what are ants about? It's about community. It's about teamwork. It's about collaboration. And so I'm like, okay, there's a message there, you know? And it's so cool. Somebody who knows I love nature in my city was like, you've got to go visit this park. It's pretty hidden. It's in the neighborhood, but you would love it. And I'm like, awesome. So I go and I finally make it to check it out. And I'm like, there's so many pathways. Which way am I going to go? So I drop into my body and I'm like, my body knows the way. It's going to lead me to where I need to be. So I end up going right, and I immediately see a collage of tile that has cardinals in the middle, which means something to me. I actually lost my father to cancer when I was in college at the age of 19, right as I began my somatic studies. So this whole somatic journey for me was like, oh, I was processing grief in real time. And so I saw the cardinal and it was outlined in monarch butterflies. I was like, are you kidding me? I feel like I'm home. Beautiful oak trees on the property. I turn left, there's this boardwalk, and it was like a boardwalk with a porch and then a screened in building, and it's like suspended in the trees, and then below it is like this concrete place. And I was like, oh my God, it's like almost the treehouse of my vision. And I was like, and it had monarch butterfly cross inside, and it was just an empty room. So I was like, that's so cool. Like, here is my, like, I always tell people, you have to, with somatics, it's all about like getting into the feeling of what it is you want for your life. And then through the feeling, you begin to create the reality. But our logical mind sometimes wants to fight us on that because it will create evidence to say, that doesn't exist. And so I always tell people, like, really tap into experience. You'll begin to see the evidence, but you gotta be committed to the experience. And then throughout time, you'll see these little breadcrumbs, I call them, and they'll start to appear in your life, and you'll start to begin to notice, and you're like, huh. And it's like my favorite thing in the world when people that I mentor for over time start like really connecting the dots. I'm like, yeah, you're doing it, see? Like, and I'm like, it's you. I'm providing you the guidance. I'm providing you a bunch of practical techniques, but it's you applying it to everyday life that you begin to see the work in action. It's so cool. And then I was recently asked to be part of a collective of practitioners for a center for neurodiversity that they're building in my city. And they were asking me about my modality, and I said a big part of my practice is creative expression, somatic inquiry into creative expression. Because the gap I was seeing in like personal development, mental health space was like, they give you a lot of tools and techniques, but then you're like kind of on your own to like do something with it. So I want to make sure that people get to leave my experiences with like something tangible. Even if it's scribbles on a paper, it actually represents something. So I was talking to the coordinator about this, and she's like, oh, wait until you see our art studio. I'm going to take you up to it in a minute. We go up to the art studio, and it's an indoor-outdoor art studio, and the whole wall is glass accordion doors. And then it stretches out onto this balcony. with a beautiful open sky above it. And I was like, oh my God, it's like if I meshed what I saw a year and a half ago at this other place and this, like that's pretty close to my dream. And I look up in the ceiling and guess what there is? A disco ball. So I was like, okay, the other place had the trees and the monarch, and this place has the open glass wall and a disco ball. So I was like, thank you, universe. You're showing me this is coming. It's happening. And words carry vibration. And it's really important that we speak out into the world what we want to create, because it's great to journal and to reflect and to create your own practices, but find your trusted group of people that you feel safe with to share these wild, crazy ideas with. And if you don't feel like you have those people, find me, find my DMs. I love hearing from people. And you'll begin to see just how amazing and magical life can be. It's not always like fantasy and fiction. Like, this can really be your life. You have to be the one to create it though. Nobody will create it for you. And so I just want to invite y'all into a really quick little somatic practice by bringing consciousness to your walk. And we've been sitting for quite a while, so I'm sure some of y'all want to get up. So I invite you to just get up and just push your chair in so we've got a little bit of space to just walk around. But I want you to just begin walking around like normal. Pretend you're going to go take another seat in the room. Really just take a nice breath and an audible exhale. Move some of that energy that's just been sitting there in your body. And bring some awareness to your feet as they're touching the ground and to the pace of your breath. We're not judging, we're just noticing. Somatics is all about noticing and suspending judgment, being the objective observer of your life. Feeling your feet on the ground, notice where your breath is starting. I invite you to take your next breath by drawing it up from your feet, breathing in the energy of the ground. Start to move the breath from the feet up the body and just notice how does it flow. Taking the breath up the feet, through the knees, through your hip space, up your lower belly, upper belly, into the diaphragm. And let's exhale this breath from our heart space. And then this next breath, we're going to just notice the difference. We're going to draw this breath up from the sky and down our head first. So take that breath up from the sky, down the crown of the head, across the face, down the chest, down the abdomen, and down the legs. And just notice any difference there. Beautiful. And then you can pause where you're at and just bring your hands together. And we're just going to rub our hands together to generate a little bit of energy, to remind ourselves that we are energy, just like the sun. You might feel your fingers and your fingerprints. Just notice what awareness do you have. Maybe it's the temperature that your hands are and how that changes as you continue to rub. And then you can begin to slowly pull the hands apart. And notice what you feel between the hands. What sensation is that?
It's like a vibrating energy.
Yeah. Does it have a color or a texture? Noticing what that is. Noticing maybe its speed. And then if you played with that a little bit, just expanding the hands. This is a great way to know what your self-energy is. Because when we are in rooms, we co-regulate with one another through this same energy field, through our heart space, through our heartbeat. And so it's important, if you're someone who wants to lead spaces, whether in groups or provide a service to someone one-on-one, that you check in with yourself, that you know where you're at in every present moment, because it's always changing. We're always changing, just like nature outside. And this is a beautiful way to just check in with self and know, where am I today? How am I feeling? Because you know your origin point. And it humanizes the experiences and relationships that we have with people. And that is a big goal of the work that I do. And so in an act of reciprocity, to remind yourself that you have everything that you need to accomplish whatever your dream is in life, take the right hand and just gently place it over the heart. We're giving back our own energy to ourselves. Have you ever consciously done that? What does that feel like in this moment? And you can put the left hand right over. A fun fact about our hands is they're also an extension of our heart space. And one of the things that I teach and mentor is developing our listening hands, because we do a lot with our hands in the world. And when we bring consciousness to what those hands give to others, how those hands give to ourselves, it changes everything. So thank you for doing this practice with me today. And if you want to take it a step further, I encourage you to just draw or write or do some sort of creative expression from this little practice you did today. What did you experience? What was that color, that sensation, that texture? Get creative with it and then revisit it over time. And just notice, we planted a little seed and it'll continue to grow. So thank you for playing along with me.
Thank you. Thank you so much to everyone for sharing your work with us. There were a lot of really incredible connective threads between everyone's work. And I just jotted down a few things, but I think everybody's work in different ways are collapsing like the false binary of body, mind, embodiment writing, artist, scholar, and looking at everything from a much more holistic, all-encompassing way of being in the world, as well as thinking about care, not only care for others, but care for the self. And so all those really resonated with me. And I don't know what time the next event is, but maybe we have time for a few questions, if anybody has questions for the panelists.
I just want to say that I appreciate your time, and I think it was so interesting to learn about the acting in the medical field. I never thought about going to the doctor and then having to do that fake situation before they got to me. I have ADHD, and I didn't know there were comics out there about it. I'm interested, and yours really connected with me because I tried to adult too hard for a little bit, and I realized that's not what this life's about. And I'm all about the spiritual universe now and like the energy, and I enjoyed everything. So thank you all so much.
Thank you.
Thank you. I don't know where Campbell went, but is there an event in here?
Yes. I mean, we have expressive narratives right after this.
Okay. Okay, well, maybe if you have questions, I'm sure the panelists will mill about for a bit. But thank you so much, and thank you to Jasmine and Devontae for joining us online. Thank you.
Thank you. That was fun.
Oh, y'all are awesome.